How is that impacting public health?
Sequestration is about a $300 million reduction at CDC, and that's on top of reductions over the past few years. It hits every part of our agency, things that prevent cancer, outbreaks, and importantly, it affects state and local health departments. About 2 out of every $3 that come to us go out to state and local health departments, and over the past few years, they've had major reductions because of state and local budget cuts. So there are about 45,000 fewer people working at state and local levels today than there were just a few years ago because of the state and local cuts. With a $300 million reduction in CDC, that translates into about $200 million less going out to state and local governments, thousands fewer people who can find problems and stop them and prevent them from happening in the first place.
You had mentioned during the Reuters Health Summit that we're in an environment where a lot of countries are scaling back on funding for public health. Given that environment, how are you trying to restore some of those sequestration cuts?
Well, what we're doing is using every penny we're given as effectively as we can. We know that money is scarce, and we know that public health and prevention is a best buy. If you look at immunization, every dollar we spend on immunization prevents $3 in healthcare costs and saves $10 for society. So prevention saves lives and saves money. And part of what we're doing is making sure that we're able to document that and explain that to people. And part of what we're doing is make sure that every dollar we spend is well spent.
Can you give us an example in the case of, say, the latest flu outbreak, the bird flu outbreak in China, how reductions in funding and budget impact that?
One of the things that we need to do is to continue to advance our ability to detect and respond to health problems. And we have ways now that we can go into the genome of microbes, learn more about them, and figure out what's going to happen in the future. It's the closest thing we have to a crystal ball. Figuring out what's the range of genetic sequences in a flu virus, for example, that may predict if it will go person to person, or become drug resistant, or be able to be vaccinated against more effectively. We need to invest in that kind of research and project so that we can protect Americans more effectively. And that's one of the things that we're less able to do with less money.